Caring for your incisions is an important part of the recovery process and oftentimes rushed through or overlooked or forgotten once you get home. In this module, I wanted to remind you of just some of the simpler, finer points of caring for your incisions. Shower is probably the best way to care for your incisions. You don't want to soak in the tub or a hot tub, not tube, hot tub. And you don't want to submerge your incisions for probably about 6 weeks until they heal. Photo at the right there is me immediately after getting my chest tubes out and still quite swollen and edematous from the extra fluid on board. So the order of cleaning, generally wash your hair first and then start with your incision. The reason being is you don't want to have some bacteria from, say, your armpit or your groin contaminating your washcloth and then rubbed onto your incisions. So get a fresh washcloth, put some antibacterial soap on there without scent. It's important. The scent will sting and burn. And gently pat and wash down the sternal incision, and then followed by any other incisions you have, which are likely chest tube incisions or mediastinal tubes, or in my case I had some healing incisions from pacemaker wires, and wash those, gently rinse them off, and make sure to use a clean washcloth every time. And you want to dab them. You don't want to scrub them. You don't want to disrupt them. You don't want to pull on them or pick off any scabs. Just let them heal naturally, and then go on and wash the rest of your body and finish your shower. When you're done, it's important to dry your incisions first and to not put any lotions or powders or creams or perfumes or anything else on the incisions. You want to give it the best chance to heal and to minimize the scarring. Scarring is a normal part of healing. You're going to have some scars, undoubtedly, but if a wound opens up or becomes infected, the scar is generally significantly more noticeable, also raised or depressed, and has a different texture and is just can be unsightly. So when to worry? If it's red, if it's painful, if it's oozing, if it smells bad, if it looks bad, if it opens up, if you get a fever, if you're having increased pain or unusual symptoms, any of those can be a sign that there's a problem with your incisions. Call your doctor, call your surgeon. Don't wait. Don't let an infection get ahead of you. Worst case scenario would be an infection in the sternal incision that progresses deeper into the sternum itself, which can be catastrophic and result in ongoing need for more invasive and significant surgical procedures. If you're at all interested in a time-lapse video of healing, just see the video's extra section. The video will take you through immediately after surgery all the way up until 6 to 8 weeks after surgery. So you get an idea of what it looks like on a day-to-day basis, and you can access that section if you're interested.